What's up, guys? Sorry, running a few minutes late, but we are just getting started here. And we're going to give it a couple minutes to let you guys start chiming in with your running injury questions. How you doing, Syed? All right, give me just a minute, guys. I'm getting everything set up here. All right, so if you don't mind chiming in, let me know if you can see and hear me okay, and then we will get started. So this is the third week of doing our show, the live office hours, where we mainly go through a lot of the injury questions that you're currently having. So go ahead and start sending those questions in. And kind of like last week, we want to be as detailed as possible so that I can get the full story of what's going on to better help you. All right, so can you guys see and hear me okay and everything? All right, so just kind of waiting for people to start chiming in here with some questions. Hey, Heather. Coming 5 by 5. Yeah, just as you guys are starting to chime in, give me all the details you can about what you're currently experiencing with the running acre pain, and then we'll go from there. So we had some great questions last week as far as the type of question we need. So say we're talking about knee pain, if you could tell me what part of the knee hurts, above, below, inside, outside. Very briefly, when it hurts, is it before the run, during the run, after the run, or all of the above? And that'll help me get as specific as possible with you. All right, great. So hi Samya, John, and Elok. Appreciate the feedback there. Glad you guys can see it and hear me. And with a lot of this stuff, so one of the things we're excited about doing is really the first of its kind. It's basically telemedicine for runners that we're offering through the run experience. So I'm going to get as specific as I can with these injuries, but there'll probably be a few questions where I say, hey, you know what, go through the website, set up a one-on-one consult with me so we can really get to the bones of what's going on to get as specific as possible. So there's basically two types of appointments. There's one that's more of an injury consult, and that's going to be where we set up a 30-minute Skype or FaceTime call, go over the specifics of your running injury, and then I'll send you a follow-up exercise prescription as far as how to get right to it with rehabbing it at home. There's also something really cool that we're doing where we do an online gait analysis where you send me a couple different videos of you running, and then we use a program to slow it down into super duper slow motion, 240 frames per second, and then we do a line analysis to see what's happening with your gait. I can again give you some exercises to start fixing what's going on. All right. McDuck Films, what's up? Thanks for coming. So we're starting to get some good questions in here. Keep them coming. We're going to be on here for about 45 minutes, and I'm going to get to as many as possible. A little bit more about me. My name's Dr. Kyle Bowling. I'm a sports chiropractor by trade. I have an office in Louisville, Kentucky, and I specialize in working with runners. So all day, every day, I'm dealing with runners. Anyone from the weekend warrior who runs a couple times a week to professional Olympic trials qualifying runners. So kind of have experience all over the board with working with these running injuries. So I'm excited to extend this to you guys on a bigger stage. All right, so we'll go ahead and get started with our first questions. First one comes from, I hope I'm pronouncing this right, Elok. It says, hi, I experienced pain in my left knee while running. I also stopped running, but it didn't help. Now I'm again running, but the pain persists. So that would be one where I would definitely need a few more details. So if you want to chime back in, we can come back to it. I'd like to know what part of the knee hurts. So is it above, below, inside, outside? Also, did it hurt mainly the entire run, or is it the type of thing that loosened up as the run went on and then felt okay until you were done, and that kind of thing? So if you don't mind chiming back in with what's going on with that. Next one, this is from Just Crow. I have a flexible flat foot and my foot kills the day after I run. The pain is on the outside of my right foot from ankle to toes. So this is a real common one I see in the office all the time. A key to evaluating these running injuries is figuring out if this injury is caused from a lack of mobility, which would be something is tight, locked up, which, stretching, foam rolling, myofascial release, that type of thing would help. Or is it more of a stability underlying cause, which means something has gotten a little bit weak or unstable, which then causes other areas to overcompensate, and then we wind up with multiple injuries. So Just Crow, if you know for a fact that you have a flexible foot and it's starting to hurt, it probably needs more of a stability approach. So there's a bunch of good videos that we posted on the Run Experience about how to strengthen the feet. There's some videos that focus more on the mobility, which would be using a lacrosse ball, a foam roller, and digging into the bottom of the foot. With yours, it sounds like it would be the opposite. So, a lot of one leg balancing, putting a towel down on the floor and scrunching it up with your toes to be able to work those intrinsic muscles in the foot. A lot of times these foot injuries kind of work like low back injuries, where you have all of these small intrinsic muscles that become weak, kind of like if your core becomes weak, around your abdominal and low back areas. If those areas get weak, then you end up with other types of injuries. So the foot's kind of the same way. Those intrinsic muscles are used for stability primarily. So if they get weak or stop doing what they're supposed to be doing, a lot of times that'll predispose you to foot pain, plantar fasciitis, Achilles pain, metatarsal pain, things like that. So that's where I would start for sure. Next from Johan, he says, when I'm running at a faster pace, I start to get pain high up in my right hamstring that limits my potential at running. So this is also a super common one that I get asked about all the time, and I've joked with people that's kind of been the injury of the summer so far in my practice, that that high hamstring pain. A lot of times we call it insertional hamstring tendinopathy. This is one that can be very misleading because a lot of times if we have hamstring pain, we're thinking, all right, hamstring hurts, I just need to stretch it more. And a lot of these cases with high hamstring tendinopathy, it's not that it's tight, it needs to be stretched, it's being overworked. So two of the first things I look at in a clinical setting as to why the high hamstring hurts is, are the muscles on the front side of your leg tight, mainly your quads and hip flexors, which can then pull your pelvis forward into an anterior tilt. A lot of times if that's the case, then that's going to elongate your hamstring even more and cause it to be overworked. So you want to do some of the normal stuff as far as foam rolling, doing lacrosse ball, stick roller up into the hamstring glutes, that whole kind of posterior chain area, which is all the muscle on the backside. But I'd also be looking at what's going up front. If you notice your quads are tight, that's going to be one to help get that pelvis back into a neutral alignment. So that might be one that would be good for gait analysis, because that's something that often shows up in your mechanics, where if you're not getting enough hip extension or activating your glute muscles or your bottom muscles while you're running, it can overwork the hamstring too. So that would probably be a good time to do some gait analysis, which I would be happy to help with. It's also very common for it to happen when you're running at a faster pace, because that's when you're really going to be loading up those areas, focusing on knee lift and hip extension. So again, that's where gait analysis would probably come in handy. Next, from Sean Scott. That's awesome. Hello from South Africa. He did a 21-kilometer race last week, and after the race, he noticed the arch at the bottom of my foot hurts. Is it sprained somehow? Common area to be sore after a high intensity run. So that would be one that I would primarily rest. I mean, if you just got done with the race, you probably want to give it a couple of days to recover. So you probably didn't sprain anything. That's usually an area that you can strain. Strain, more of like a ligamentous type of area. A strain comes from more soft tissue, which is primarily on the bottom of the foot. So getting into some good toe stretches, getting up on a lacrosse ball, that would be a good example of when to use a lacrosse ball on the bottom of the foot, as opposed to before when we were talking about strengthening the foot. So that's where I would start. But we also kind of expect this type of thing after a race, like I said. So next question from Somya. So, hey doc, hello. My right foot is a bit smaller than my left. I've always had issues with heel slip. I use a runner's loop on my right shoe, but still my ankle gets injured. That's one, I would probably have some follow-up questions with that, and that might be one that would be smart to get on a one-on-one call to get to the specifics of it. I'd be curious to make sure your shoes are fitting right and what kind of pain you have on your ankle. So maybe you could chime back in and let me know, is it the right ankle that hurts and what part of the ankle it is. And then next, all right, so kind of to go back to a previous question from Alok about his knee pain. So he says it's pain towards the right part, towards the outside, and the pain is not acute, but I can make out that it's wearing out. So that sounds like a classic spot for IT band pain. Usually that's either IT band pain or lateral runner's knee, which would be inflammation to the patellar tendon. So the first two things I would look at, one, are your quads tight? Two, excuse me. Two, a lot of times if it is the IT band, it's coming from weak hips. So doing some core and hip stability, which we have a lot of good stuff on the Run Experience about, as well as really getting into the TFL, which is one of the small muscles on the outside of the hip with a foam roller or the cross ball. That would be good. And that's one that can be misleading, because obviously if it is IT band pain, you're having pain on the outside of the knee, but it's actually coming from further up the kinetic chain close to the hip and side of the hip. So that would be the first place I would look. All right, so moving on to some of the next questions. This is from Sasha. I have a minor stress fracture that is 90% healed, almost there, good job. I still see really slight swelling on top of the foot. Is it okay to take a spin class on it? Am I healed enough to start working out? That's one, stress fractures, you don't want to jump back in too soon, because that's one that if you say you're 5 weeks into healing, which is probably right around where you're at with it being 90% better. Excuse me. That's one where if you go back to running or spinning even a little bit too soon, you're going to delay it even more. I mean, it's going to put you back to ground zero, and you're going to have to spend that next 4 to 6 weeks healing again. So it's very easy to have setbacks with that. As far as a spin class, that should be okay, but I wouldn't do anything as far as high intensity with like going uphill, because that's when you're going to stand up in the seat and then really pedal and be a little bit more weight bearing than you would if you were just sitting in the seat. So that should be fine, but just keep the resistance kind of low to where you're mainly focusing on repetitions, keeping the legs going, getting the heart rate up, working on the cardio, and then waiting until it's closer to 100% to actually do more of an intense bike workout. So, but you're almost there, 90%. So next question, from John Duffy. Not really a pain, but I have some flexibility issues. Toes, tight quads. I've seen conflicting studies on pre and post run stretching. So great question there. Glad you brought that up. And that's something that seems to be widely debated. Should I or shouldn't I stretch? I'm firmly in the camp of stretching a cold muscle pre-run is not a good idea. Areas like their rubber bands. So a lot of times a cold muscle, that when I say areas, picture your muscles like they're rubber bands, specifically like a cold rubber band. So you put a rubber band in the freezer or a fridge, you take it out, and then all of a sudden put a bunch of stretch into it. What's going to happen? It's going to tear. So that's what can happen to some of our muscles. I think the much wiser approach is to either do more of a dynamic warm-up, which we have a lot of good videos for on the Run Experience, or just getting down to where you're putting slight stretch into the tissue, but you're also stimulating blood flow. You're getting the areas prepared for what they're about to be asked to do, which is repetitive motions, and warming up from that end. And then, if you're halfway, or we'll say 10 to 20 minutes into a run, and you feel like things aren't moving quite like they should be, that's when I would stop, get a little bit more into the traditional stretches, and then of course after the run would be okay too. But I've myself had injuries or muscle strains from stretching too much pre-run, and I treat them all the time too. So that's when I'd be real careful with. And again, I'm going to get as specific as I can with answering these questions. But we're also really excited to be offering the one-on-one injury consults, where it's just me and you one-on-one. We get on a Skype or FaceTime call, spend 30 minutes going through the specifics of your injury, and should be able to diagnose what's going on, and then either find you a specialist in your area, whether it's a good physical therapist, chiropractor, orthopedist, that knows runners, or if it's the type of thing that you can get better on your own, that's where I send you some specific injury or exercise prescriptions to start rehab as soon as possible. So that's one type of appointment we're doing that's been, I feel like it's helped a lot of people who haven't been able to get maybe the answers they need as runners. I think there's not enough what we call running specific healthcare offered, meaning, if you go to a typical chiropractor, PT, ortho, whoever, who's not a runner themselves, a lot of times they're very quick to say, oh, your knee hurts when you're running. Well, and that's not going to cut it for us runners. That's like telling us to stop breathing. We need to know, is this truly something we need to stop running for, or is there a chance we can get over this while running and healing at the same time? that's why we're excited to offer the injury consults. And then we're also doing gait analysis appointments where you very simply send me a couple of videos of yourself running, plug them into a program, and then we analyze the angles that your hips and ankles and core is moving in, and helps us get to the bottom of a lot of these running injuries where, just because your knee hurts doesn't necessarily mean your knee is the underlying dysfunction. A lot of times there's something above it or below it that's causing that ache or pain. So really helps us get to the bottom of what's going on. So we're excited about that as well. Next question is from Carrie Hale. She says, was going to schedule a gait analysis with you, but 3 weeks ago I started experiencing tendonitis on top of my right foot. Now I run different. Would it be better to wait for the gait analysis or do it now? That's probably one I would wait for, because even if you're trying as hard as possible, you're probably going to be having motor control issues where even if you don't realize it, you're moving your foot or knee or hip one way or a different way than you normally would to try to compensate for the pain. So hopefully that one heals up quickly. And then, yeah, as soon as you feel like you're running with your natural mechanics again, that's where we could certainly get to work. Next question is from AA Strength. So I cut my left big toe really deep and it is still healing. My toe is fine, but it is still open. I bandaged it up, but I want to know if it is good to run on it. That's tough, AA. If it's still open, I'd be real careful with that, just with your foot being enclosed in a shoe. A lot of times that would open you up to different bacteria or infections. So that would be one that would be a question I would have for your primary care provider, just because that's a little bit out of my scope. But hopefully that's the type of thing that continues to heal and you're back at it as soon as possible. So sorry, I can't get a little bit more specific there, but one that I would certainly defer to your primary care physician. All right, so moving on. Next question is from Hardik. He says, hey there, I recently started running and I am experiencing shin splint pain and it hurt a lot. How to fix it? Hardik, shoot me a follow-up here because I want to know if it's there's two types of shin splints. There's one that's called an anterior shin splint. That's going to be kind of on the front of the shin, or there's posterior shin splints that's kind of on the back of the shin, kind of behind that tibia. I'd like to know which one it is, and that'll help me answer your question a little bit more accurately. Next to Ferdinand, new runner 1 month now. That's awesome. Congrats. Stick with it. 2K a day, 5 times a week. When can I increase my distance? Knee pain sometimes already. So Ferdinand, you're right in that initial, what we say 4 to 8, sometimes 10-week period where you're just getting into running. Your body's acclimating. You're probably feeling beat up in a different way every day you run. So the best thing to do there is be sure you're warming up adequately. Make sure you have a foam roller, stick roller, lacrosse ball, and you're going through your calves, your quads, your hamstrings, your hips to make sure everything's being warmed up adequately. And then really easing into each run. Don't worry about going too fast too soon, because right now we are basically just in our base building stage where the goal isn't necessarily to get fast, it's to get strong, it's to get your body used to running. As far as when to increase your distance, one kind of old school rule that I think is still pretty accurate is the 10% rule, meaning you don't want to increase your mileage more than 10% per week. So that now would be a good time to apply that to where you're improving, but it's just slow and steady. So hopefully that helps there. But it's perfectly normal to feel really beat up a month in. You're a new runner, so stick with it. It'll get better. Once it does get better, you're going to love it. All right, so circling back to, give me just a second. Somya, so you had the question about, I think it was your feet are 2 different sizes. One of them slips, the right ankle, or the ankle hurts. Says it's the right ankle. that sounds like it's a shoe issue. So again, that might be one where we need to get on a more specific call so I can see a visual of what's going on. But first thing I would look at is, and if you feel like your foot's slipping, you need to switch up the shoes, whether that's getting into more of a narrow shoe that hugs your foot a little bit more. But that's the first place I would look. All right, so moving on to Adley. I have a bunion, it's been hurting recently. What to do while pain is acute? So that's also a real common injury I see in the office, and that's something that is purely mechanical. A lot of times, when you have bunion formation, which is, if you can see my foot model here. So this is first metatarsal, that's fifth metatarsal. The bunion formation is right on the outside of that first metatarsal. So a lot of times if you are in the wrong shoe or your foot's unstable, your foot will pronate, which then starts putting more stress on the outside of the first metatarsal there. Your body senses that, okay, there's more work going on here that needs to, than is what it's prepared for on the first metatarsal. So it starts laying down more bone, and that's when you start getting that visual appearance of that bump on the outside of the foot. That typically then leads to more issues because everything starts, as that bone starts being laid down, everything starts moving that way, and it just basically messes up the alignment of your foot, creates all kinds of other issues. So if it's acute pain, my favorite and go-to, correct toes. So I recommend these. We talked a little bit about them last week, but this is a great way to, and I'm going to use my model here though, but it's a good way to really start to get that foot realigned back to how it needs to be. So you kind of put it over your toes like that, spreads the toes out the way they need to. So that would be the first thing I would do, is maybe get online and order a pair of these. Again, they're called Correct Toes. You can go to correcttoes.com and get them. Outside of that, probably not in the right type of shoe. So that's where a brand like an Ultra, it would be good because it allows your foot to sit flat and your toes to spread out. So that might be something to approach initially as well. All right, so next question, we have Adam. I had 2 stress fractures in both legs and they were feeling great, but now they are both hurting again after 3 weeks. Any thoughts on why it could? I've been spinning from day one, nothing crazy. So sorry to hear about the stress fractures. I've had plenty of those, and they're not fun to deal with, but fortunately they do heal. It's pretty common to have what we call phantom pain coming back from stress fractures. I've had it a few times with mine, and a lot of my patients will have it too. If it's back, if the pain you're experiencing is back to feeling exactly like the beginning of the stress fracture did, where it hurts when you're non-weight bearing, it hurts at night, it aches, throbs, then I would be concerned it hadn't healed up properly. If it's the type of thing that aches, throbs, but kind of goes away while you're running or while you're cycling, then I would say good chance it is just that phantom pain, because one of the telltale signs of a stress fracture would be, if you start that run, say the stress fractures in your shin, it hurts at the beginning of the run and then gets worse throughout the run. There's no warming up or getting used to it. So if that's the type of pain you're still experiencing, then I would be concerned, maybe get some imaging done to see where it's at in the healing phase. But hopefully it's more in that phantom pain type of category. But it's tough because it messes with you mentally just as much as physically, because you spend all this downtime getting over the stress fracture, and then you get back out there and it's still hurting. So let me know if I can help any more with that. All right, next question from Sean. Any tips on stopping repetitive calf and lower leg injuries within the gastroc and my soleus? I always feel a dull pain and ache later in my run, always on the left leg. So that's a common one too. The calves, I think, are one of the muscle groups that take the most beating during your run. So I would compare a gastroc and soleus strain to have the mindset of a stress fracture. It's not nearly as serious as a stress fracture, but it's the type of thing that, say you strain your calf and you only let it get 90% better, and then jump back out there, chances are it's going to flare up again. And that's, you know, a lot of times you'll turn one calf strain into 10 because you keep just going through that cycle of letting it heal, but not quite enough, and then bam, it's right back to where it was. So assuming you've taken enough time off, and that's, you know, I'm all about keeping people running through injuries that you're able to work through and not make it more severe and not have to take too much downtime. Calf strain is one of the ones, unfortunately, I would tell you, if it's still an active strain, get in the pool, get on the bike, get on an elliptical, because we've got to let it heal before you start back with the high impact. So aside from that, you want to make sure you're going through a really good warm-up pre-run, taking a foam roller, lacrosse ball, and digging into that spot on the outside of the calf where the gastroc and soleus meet. That's usually a good strategy. Maybe testing on a shoe with a little bit of a higher heel to toe drop, depending on what you're running in. That could deload the calf a little bit. So those would be two things to try. Aside from that, if none of that's working, that's where I would definitely say get in touch with me. We'll set up a one-on-one consult and then get to the bottom of it even more. So next from from my wife Lane, she says, Emerson and Theo say hi. Hi guys, love you. See you soon. Next question. From Elizabeth George. How do we schedule those? They should be in the, I've seen you're talking about the appointments with me. They should be in the description category underneath this video. There's the first one, we should say schedule your one-on-one injury consult. The second one says schedule your one-on-one gait analysis. If you follow that link, you can very easily set it up from there. If that's not working, then email me. It's kyle@therunexperience.com, and I'll shoot you the link as well. All right, so we got about 10 more minutes. Moving on. This next one is from Kathy Jane. I signed up for the gait analysis, but I cannot run due to recent Achilles tendonitis and plantar fasciitis. I have a diagnosis from a doctor and a PT. How will I know when it's safe to run again? It really depends on how bad it is. That's one where if it's so bad that you feel it from the first step, I would cross-train and continue to follow the directions of the doc and PT until it's a little bit further along. I usually am big on figuring out if it's more of an issue that's caused from the calf being tight that then tugs on the Achilles and plantar fascia, or if it's from a lack of stability with the ankle and the foot. Hopefully they were diagnosing that correctly. Really, you have to wait for us to do gait analysis until you're running comfortably again. If we did it right now, it would just probably look like you're limping and favoring that one side, which won't really tell us the mechanics of what's going on. So, but if you don't feel like you were evaluated appropriately, again, from a running perspective, I could help out more. So that would be one to set up an appointment for a one-on-one consult, and I'd be happy to help. I'm sorry to hear you're dealing with that, but neither of those are career-ending or season-ending injuries. Dealing with it appropriately. So next one is from Stephen Webb. The next one is from Hardick, who'd asked me about shin splints. So both of these questions, Stephen says I get shin splints on both sides of shin. Hardick says I'm experiencing front shin splint pain. What to do? That's usually, if you're getting, first Stephen, if you're getting both of them, that's probably coming from the calves. If the muscles on the back side of your leg, the calf, the gastroc, the soleus, to get tight, they inevitably start tugging on those muscles on the front side, which would be the anterior tibialis, posterior tibialis. Those are the two types of shin splints that you get. So definitely a lot of calf work there, specifically pre-run, to make sure everything's warmed up and ready to go. Also using like a stick roller on the front side of your shin to warm up those muscles. Doing heel walks and toe walks as part of your dynamic warm-up pre-run would be good to loosen everything up. So hopefully that helps there. But in both cases with the shin splint, like if you can get it calmed down early enough, or at least stop in its tracks, a lot of times you can run through that type of thing. So that's nothing I would tell you to necessarily take a bunch of time down for. Excuse me. So next, coming from Kathy Jane Sturdivant, can you fix posterior tibial tendonitis? Yes, and that goes back to the classic example of needing to figure out, is it a stability or mobility fix? So stability meaning arch has gotten weak and unstable, which then tugs on the posterior tib, which then causes it to become painful after a while. Or is it calf, soleus, gastroc, get tight, start pulling on the posterior tib, and it gets inflamed that way. So that would be a good time to do either gait analysis or one-on-one injury consult, so we can get to the bottom of that. All right, so we got about 5 minutes, and let's see. Oh yeah, we got plenty of time. All right, so next question from Elizabeth George. My calf hurts. It feels like a Charley horse, cramps in my leg when I walk, and gets super tight when I run. I got a massage and it doesn't feel better. That could be a couple of different things. If it's when you walk and run, I would suspect there might be something nutritional going on. So getting checked out from your primary care might be a good idea to see if you're dehydrated or if any of your potassium, magnesium, and your vitamins or minerals are off. A lot of times when you're running and you have that cramping type of sensation, that's an actual strain that's happening, and that's one thing that's misleading. Is a lot of times you'll be running and you'll feel what you think is a cramp in your hamstring or calf, so you keep running, but it's actually a small strain that happens. So, but first, if it's happening when you're walking too, I would get that evaluated to make sure there's no dehydration or anything underlying there. Next from Artem, he says, interested in your comments on shin splints. I've been diagnosed with anterior tendonitis, first time in 4 years of running. I've had to stop running for 2 weeks. Acute pain is gone now, though. In anterior tibialis tendonitis, in which case that's the less serious of the two types of shin splints that you get. Yeah, that's one that I would tell you to attempt to run through, as long as you're doing the right things, such as using a stick roller down the front side of your shin where your anterior tibialis sits. Also, working on warm up through doing heel walks and toe walks pre-run, just to kind of get those areas going. Also foam rolling and really getting into those calf muscles. But that's one, like if you had to pick the type of shin splint to get, you'd pick the anterior tibialis, because it's much more treatable. A lot of times it heals faster and it won't turn into a stress fracture like the posterior kind can. Next from Ola, says, hi doc, you're doing a great job. Thank you, appreciate that very much. Last week I started feeling pain on the inside of my right knee. Now it's worse and I have trouble walking down a stair. Could it be undertrained leg muscles? Excuse me. That's one. A lot of times if it's the inside of the knee, the first thing I do is look directly above the kinetic chain, meaning when you're running, is your knee internally rotating or collapsing inward? A lot of times, because if you think about the knee, a knee is a hinge joint, meaning it's supposed to do this and that. It's supposed to go into flexion and extension. If we try to take that hinge joint and turn it into a multiplanar joint where we're going into flexion, extension, and then a bunch of rotation, where there's a bunch of torsion in that knee, a lot of times that's what wears it out. So if hips are unstable, a lot of times it will cause that knee to overcompensate and start doing those multiplanar motions. So the first thing I would do is look at core and hip strength. That's where the meniscus sits. So if you're getting swelling and a bunch of decreased range of motion, that's where I would probably have that checked out by an orthopedist or your primary care doc, just to make sure nothing's structurally wrong. But as long as it's less than that, first thing I would tell you to do is make sure you're in good shoes, and then assess hip and core stability. That would be one where gait analysis would come in, because most of the time when someone comes in the office and has that, it shows up on gait analysis, where when you plant down, that knee buckles in and it shows very clearly where it's coming from. So let me know if I can help in that regard. And then our last question from our very own Craig, who couldn't make it today. I think he planned this to just have me do it, and this is like a form of hazing me onto the Run Experience team just to see if I can handle it. So I hope I've done well, done the best I could. So I have a slight hamstring strain from playing pickleball. I can run, but not sure if I'm doing more damage or if I should be doing something else. Craig, if you're fixing this this heel strike, then you should be fine running. But if you're still locking that leg out, landing in front of that center of gravity, putting that extra strain in the hamstring, I would tell you to aqua jogging or cycling. So hope that. And then time for one or two more. Kathy Jane says, how do I find a good doctor? Ask questions. Find some good sports-centric people that focus on athletes, chiropractors, PTs, orthopedists, whoever. Website to see what their treatment philosophy is, making sure they're evidence-based, making sure you're not gonna go into their office and they're gonna want you to sign up for a big long treatment plan type thing. I always say to stay away from that. A good rule of thumb, I think, when you're trying on a new provider is try it 4 to 6 times, or roughly 2 weeks. If you're not at least moving in the right direction after that 4 to 6 times or 2 weeks, maybe get another opinion. Hopefully that helps. But yeah, it takes some it takes some research to find a good doc in the area. So if I can help any more with that, certainly let me know. So with that, we are out of time for this week. Sorry, you're just stuck with me. We usually are able to have Craig's handsome face on here as well, and he's a very good organizer of it all and a very good MC for it all. So hopefully he'll be back next week. And if you have any follow-up questions, feel free to email me anytime, kyle@therunexperience.com. Also down below in the comments section in the description is a link to set up any appointments with me if we need to get any more specific on what's going on with your current ache or pain. So thanks for tuning in, and I'll look forward to seeing you guys next week. And now, what do we call this? The awkward dance as we transition out of the live page.